everyone, I'm Jamie with Liberty Mental Health. Today I wanted to go over therapist red flags. So, being a counselor myself and also a client seeking therapy, there are some obvious things that I have noticed when working with a therapist that didn't set right with me. So, today I wanted to go over a few things to look out for when you go to your therapy appointments. Number one, if the therapist tries to have a dual relationship with you. A dual relationship basically means that they're trying to have another relationship with you outside of the therapy room. That might mean a therapist asking you out for coffee, a therapist asking you to give them a ride to the session, even a therapist asking you all the time to grab them coffee on your way to the session. These are all examples of a dual relationship that are starting to cross ethical boundaries. Another obvious example of a dual relationship is if a therapist tries to flirt with you, make sexual advances at you, or have a sexual or intimate relationship with you inside or outside the session. So don't be fooled if a therapist tries to make it part of the therapy or if they're being creepy. Those are all signs that they are practicing unethically, and that's something that you can talk about with them or another therapist, because that even could be something that you report to Lara for them to be disciplined and make sure that they aren't doing that to other clients. Number two, if a therapist asks for gifts or favors. So, an example of that would be if a therapist asks for money, if they're asking for advice, if they are asking, again, to bring something to the office or bring them a gift or help, that goes against the ethical boundaries, and it can distract and deter from the therapeutic bond and from the progress that you can make, because the therapist is now making your sessions somewhat about themselves and blurring the positive intentions that would be helpful for you as a client seeking therapy. Another red flag is if a therapist talks about other clients in session. This is a passionate one of mine because I've seen it happen so many times again and again where therapists will use a lot of the therapeutic hour to talk about themselves. And if you're working with a therapist for years, you're naturally going to know more about them because they might interject things about themselves. But really, they shouldn't be taking up a ton of time in session talking about themselves. And they also, it's not helpful for them to relate everything that you're going through to something that they went through. While that might be part of day-to-day interactions with people, it can actually invalidate and distract from the client's experience because a therapist is coming at them with their experience, their trauma, their past, things that don't need to be part of the therapeutic session. Number 5. So, another thing in therapy that can happen is, and I've heard it over and over again with clients, is that they say, my therapist just stared at me. They didn't say anything, and I just talked for an hour and left. Not my style. It's some therapist style and it works. I typically will do that during the first couple sessions because I want all of the information about a client that I can get so I can conceptualize, so I can plan their treatment accordingly. But over time, I believe, at least in my opinion, that a therapist, it is more helpful for them to be directive, ask questions, open ended questions, guide them, be strategic, be intentional, offer feedback, and things like that in session versus just a client talking about themselves and the therapist nodding, saying, I understand, how do you feel, and not really collaborating with the client to work on some of the issues that they came in for. Number 6, if your therapist continually late cancels or is late to your appointment or no shows, that's a sign that them being a therapist, them attending your session is not really a priority. Or maybe the therapist has some too many things going on personally that they can't commit to certain appointment time, or they can't commit to treating clients at this time. But therapists are human. If there's an emergency or they have to cancel or they're sick, that's understandable. But if you find that they're canceling sessions more than they're attending sessions, it might be time to pick another time to meet with them or even transfer to a different therapist who can better accommodate you. Number 7, if a therapist is obviously distracted in session, and this is going to look different in person versus online, but if they're distracted in person, that could be them looking around the room often, looking at their phone, looking at computer, or just seeming off, not understanding what you're saying constantly, them asking you to repeat yourselves. Virtually, this could look like you see a screen flashing in their eyes or their glasses, like they're looking at other tabs. Or you can hear them typing without them maybe explaining that they're typing things down for you. So, obvious signs that they might be distracted could be a red flag over time, because as a client, it is important to feel heard and understood, and the therapist paying attention and being present in session so they can best help you on your journey. Number 8, the last one. This one's a little bit harder to decipher because different therapists have different approaches. But if you find your therapist being quick to make assumptions, quick to jump to tell you what you should or should not do, or giving straight up advice about what you should or should not do in life, this is often a red flag, because therapists don't know you like you know you. You are the expert on your life, not them. They have a small snippet, a small context of who you are in your life. So if they are quick to making assumptions about you, your relationships, your job, your friends, and stating things as a matter of fact before questioning and understanding more or letting you explain more, this is a this is not going to be helpful over time. So, if you're experiencing any of these things in session, I would encourage you to talk to your therapist about it. Practice being assertive, confrontational to get the care that you need. And if you find that things are not improving, feel free to transfer to another therapist, find someone else, and also tell that new therapist what you experienced before, so that you can make sure that they are on top of their game, that they are the best fit for you, and so on. So advocate for yourself. Therapists are human. We're not experts, we're not gurus in everything. We want to help you the best we can, and we want you to help yourselves as well. So I wanted to give you guys that, just things to look out for. Feel free to contact us. Go to our website, visit our blog where I talk about this topic more at www.libertymentalhealth.com.